whenever I see a patient that, is struggling to maintain a healthy lifestyle or meet the goal weight that they want to get to or start an exercise plan, I'll kind of talk about my experiences kind of growing up playing baseball and then getting involved. And some of the things that I'll kind of recommend to patients are, first, kind of a food choices are kind of stay on the outside of the grocery store and away from the middle of the grocery store, because that's where the processed foods are at. And kind of on the outside you have the good fruits and vegetables and the good seafood and meats, physical activity. I like them to start slow. I don't want them to jump into, start training for a triathlon right away. So, just walking, 30 to 60 minutes a day, walking their dog, or, taking a walk with their significant other or their children, or take their kids to the park, or, take the bike out and, just be active. And I think it's very important from a preventing medical comorbidities is to maintain a healthy lifestyle. I would definitely say it's recommended that you talk to your physician before you do partake in an exercise plan, whether that be getting a personal trainer or just starting out on your own. You definitely want to make sure you check with your physician to make sure your heart is healthy to start that sort of physical activity. 30 to 60 minutes of good physical activity a day where you kind of get a little bit of a sweat going, 5 to 6 days a week. Mix in either some aerobic training on like a treadmill, and then 1 to 2 days a week of some strength training, which just means kind of lifting weights, is a good way to start physical activity in their lifestyle. I would say, staying on the outside of the grocery store and eating, more fruits and vegetables. I feel like that provides a little bit more energy to patients to be able to perform their physical activity and exercise, whereas opposed to more processed foods, you kind of feel a little bit more kind of slug and you don't feel as energized. However, when you're eating those fresher foods, it gives you that energy to perform. Doing an activity with somebody that you know, or I guess don't know, you and your wife want to start exercising, or you and your husband want to start exercising, you kind of get them involved too and say, hey, I kind of want to start this exercise plan. Would you like to do it with me? If the answer is yes, that's great. But if it's no, then you can kind of seek like-minded people that have that same motivation, whether that possibly be at somebody at work, and kind of take off from there.